Welcome to Advocating with My Care Manager. My name is Nicole Pagano, and I'm the Director of Family Support Services here at ADAPT Community Network. Thank you for joining us. In this session, we will review strategies for strengthening relationships between care managers, providers, and families in light of the transition of MSCs to care management. It is my pleasure to introduce our presenters, Danielle Mazza, Assistant Vice President of Care Management for the Hudson Valley, Capital District, and North Country regions at Care Design New York, and Kristen Rybnicki, Senior Director of Care Management at Advanced Care Alliance. We hope you enjoy the webinar and take away some useful information for you and your family. Please don't forget to fill out our survey on our main page. Thank you.
Hello, everyone. Welcome to the CCO presentation of the webinar. My name is Danielle Mazza, and I'm the Assistant Vice President of Care Management for Care Design New York.
Hello, everyone, and I'm Kristen Rybnicki, Senior Director of Care Management for Advanced Care Alliance New York. So it's very nice to be with everybody today. Danielle and I are going to take about 20 minutes and discuss, some concerns communicated to the CCO throughout this COVID-19 pandemic. So I'm going and then we're going to end with, the role of the care management and how integral piece the care management had throughout this pandemic. So I'm going to take some time and talk about the concerns that were communicated to the CCOs. One being the health and safety concerns regarding just ensuring the care managers, ensuring that the members and the families had food, water, that they had their medicine. So in the beginning, when everything became remote and programs were starting to shut down, care managers really connected with the families to ensure that there was food, water, and medicine. And as the pandemic evolved, care managers were also involved in working with members and families who may have been hospitalized due to COVID-19 and ensuring that family members and their loved ones were able to visit them in these facilities, whether in person or through telecommunication. There was also some challenges assessing food and supplies. For example, locating some local food banks, ensuring that the families had water, and toilet paper was a big concern in the beginning of the pandemic, as well as cleaning supplies, Lysol and wipes, as well as masks, and ensuring that the families and members had masks. Another concern was the loss of supports and services, as waiver services were, not up and running due to the pandemic. You had closing of day programs. Residential providers were enforcing stricter visitation rights or visitation policies to visit their loved ones. ComHab staff were becoming unable to come into the home to provide the service. Clinical support, such as OT, PT, and speech, where the majority of our members were getting these services through school or through day program. So once the schools and day programs started to go virtual, that definitely impacted the supports that the members were receiving. With working remotely came technology and making sure that members and family had the technology to participate in team meetings or Zoom meetings to ensure that they were able to stay connected with the schools and the programs. Face-to-face meetings became, virtual, where they had to use FaceTime or telecommunication. All of this needed to be done, to continue to provide services for our members. So, some families had little or no access to the internet, which made it difficult to communicate with provider agencies, day programs, and care managers. And then the concerns now that we are 6 months into the pandemic, the concerns now related to reopening, such as day programs are starting to, come up with policies and procedures to ensure the health and safety of members that will be returning to day programs. So it's sitting down with the interdisciplinary team and ensuring that our members' health and safety come first, and looking into person-centered and making sure that the return for the members is what they want. Maybe they're not ready to go back full-time 5 days a week. So it's really important that we have that communication to ensure that day programs are able to accommodate the members if they want to start out maybe going 2 or 3 days a week part-time. So we're working on that. And just the fear of returning back to our new normal with, a lot of stores and work and parks and everything opening up, malls, and making sure that getting the members back into the community and integrated, making sure that they're able to wear masks and that they're comfortable with the masks. And if there's any additional health and safety concerns that arose throughout the past 6 months that residential providers and day programs need to be aware of prior to the individual returning to those services. So we're going to take the next couple of minutes, and I'm going to pass it on to Danielle to discuss the CCO's response to the concerns.
Thanks, Kristen. As Kristen had outlined, we did hear many concerns from, both individuals that we support and their families. And so the CCOs wanted to ensure that our care managers were really, equipped to support people during this, really unprecedented time. And we also wanted to ensure that we had an ability to have an assessment for each person supported, as well as being able to have some larger sort of population data so that we would be able to, focus our supports most appropriately. So all 7 CCOs did come together collaboratively and worked on a tool that would focus the work of the care manager to assess risk level of the people that we support related to 3 main areas. One being health risks. So really looking at some underlying health conditions that people might have that would place them at a higher risk in the event that they were exposed to COVID-19. Also looking at resource risks. So some of those things that Kristen was talking about, where people were having, difficulty accessing basic supplies, food, again, cleaning supplies was hard for everyone to find, medications, those types of things. And then also support risks, realizing that, many of the supports people had in place, both, things through OPWDD and waivers, as well as natural support systems or things that might be through personal care or consumer-directed personal assistance program, a variety of things were disrupted. And so, what were the support and supervision risks that were created by that disruption? So, this tool, again, was part assessment, but also, equipping the care managers with supports and resources so that they could best respond to these identified risks and concerns. So I know each CCO approached it a little bit differently in terms of making sure that care managers knew, based upon this assessment really that they were doing with each person supported, how to best structure their intervention and what were the types of specialized supports and services that could be offered during this, time of COVID-19. The CCOs also worked collaboratively with OPWDD to report out on data, trends, and needs that we identified so that we could advise on a statewide response. I know that many of the CCOs were engaged with, also some of the provider associations in order to look at, how can we as a system best respond to support people when, the model of supports that we've always relied on is completely disrupted. And of course, the CCOs also maintain their advocacy role to express concerns heard from individuals and families to OPWDD as well as the Department of Health. So we really wanted to ensure that, particularly things that we were hearing on a wide scale, for example, as Kristen had mentioned, there were many concerns that were reported to us around families' ability to visit their loved ones in the hospital. And so we did a lot of advocacy work with, particularly the Department of Health around that. And we're successful in having, people with intellectual disabilities having a specialized sort of carve out to that policy that would allow them to have a support person with them in the hospital. So we also just wanted to ensure that everyone knows that the CCOs, of course, we stand ready to support. And although the CCOs have largely gone to a remote model of support, all 7 CCOs have continued to actively provide support during the COVID pandemic. So care managers are working, care managers are probably busier than ever in order to do all of the things that they would typically do, as well as try to negotiate and navigate, again, this very difficult time to try to get those supports and services in place to individuals and families in order to make sure, people are, are as well supported as possible, and that people's health and safety needs, first and foremost, are protected and in place. All 7 CCOs are actively continuing to support those seeking services through the eligibility and enrollment process. So for individuals who are, who are coming into the system and looking to gain OPWDD eligibility, looking to become potentially waiver enrolled, but looking to link with a CCO and have a care manager assigned to them, we are all actively still doing that. Our intake and enrollment departments are very active, and we are absolutely supporting people through that process. And for those individuals who do get enrolled, CCOs are continuing to assign a care manager to those individuals who, do become enrolled. Care managers are continuing to work with OPWDD and the developmental disability regional offices to request supports and services. So, there's been a lot of regulatory change during this period of time. Many of you might be familiar with some of the, the different programs that OPWDD has put in place to respond to this pandemic related to, particularly related to disruption in day services, where they put in place this retainer day program to both support the providers as well as the people receiving services. But we've continued to have conversation with people we support, and we're always looking to assess and address any unmet needs that people may have. It is a bit of a difficult time right now with OPWDD and the different regional offices, and it is evolving a bit in terms of the types of supports and services that they are authorizing, but care managers are working very hard to document enhanced clinical justifications for any types of service modifications or enhancements, different services being requested. So, it's something that we're continuing to do on a care management, an individual care manager level, as well as organizationally as CCOs communicating with OPWDD as a larger, systemic issue. CCOs are also continuing to compile resources and supports that are evolving in response to the COVID pandemic in order to link members. So while, OPWDD supports and services are a large part of what we do, we also do link people to other types of supports and services, whether they are something that's through, the local Department of Social Services or just other types of supports and services that might be available in the community. So we've been really compiling that information regionally at each CCO to see, what different things are being offered that would meet the needs of the people that we support. And care managers will continue to assist with communications and advocacy efforts between the person supported and the providers related to reopening and return to service plans. So as Kristen had mentioned previously, some people are very ready to have their people, have their loved ones return to service. And some of this varies, regionally a little bit. But other people are a little bit more concerned and are not quite ready to have their loved ones return to service, or the person themselves is not ready to return to service because they have concerns around transmission and infection. So the care managers are really there to support people in a person-centered way, based on what it is that they want. So if they're looking to return to the highest level of service, possible, that's what the care manager is going to focus on and advocate for. And if the person really is, wanting to delay a bit and see if things, settle out a bit, the care manager is going to support that as well. So, again, all of our efforts are really focused around supporting the individual where they're at and linking them to the supports and services that are best going to meet their needs. So we're going to talk a little bit about some of the success stories that we have seen at our respective organizations. So I'm going to let Kristen share, some stories from Advanced Care Alliance first.
Thank you, Danielle. So as Danielle has said, the CCOs continue to stand ready to support. And I just wanted to share with you a success story that was shared with me earlier this week in our weekly bulletin that ACA puts out to all of its staff members. And back in April, we received an email from OPWDD from a father of a person that we support, informing OPWDD that his mother had passed away, unfortunately, due to COVID-19, and that the child needs home care and residential placement. The child was receiving home care, but his siblings tested positive for the virus, so the home care service stopped providing service. This was at the peak of COVID-19 when the hospitals and other healthcare systems were beyond capacity. The state was working on expanding testing sites, but the support was limited. The care manager and her team worked with the father in locating test sites, scheduling appointments, and sharing resources to have everyone tested in that household in an attempt to restore the home care. Because of the mother's unexpected passing, residential placement became important, as it was clear that the siblings were unable to adequately care for their brother on a long-term basis. At this point, the father became very stressed and frustrated as his job employment could be impacted, was at risk because he needed to remain home with his son as well as his other children who were tested positive. He left his family. Back in New Jersey. He left his family in New Jersey, and he stayed in New York with his son because he knew that they were at high risk with the siblings being tested positive. So the care manager stayed in constant contact and communication with the father and son through telephone conversations and video conferencing. They provided updates and progress and challenges with the father, and made it a point to know that we were there to support them. The care manager and her team contacted the current home health agency to advocate for continued services pending the results of their COVID test. And as a temporary arrangement, the team also reached out to providers to start researching residential placement on an emergency situation. While the team were waiting the results of the test, as I mentioned, his two brothers came up positive. So at this time, the care manager and team also sought temporary emergency respite by contacting the providers serving that catchment area, but were unsuccessful. The team worked with providers during this time to access historical documentation that would be needed to submit a packet to OPWD for emergency residential placement. So, again, they're doing this all telecommunications through telephones and scanning and emails. Within a few weeks, the dad also tested positive, and therefore the child would need a second test, which was done, and the child came back negative. At this point, the application was submitted to OPWD and was approved for emergency residential placement. Prior to him being screened and visitation, the provider agency required a third COVID test. So again, the care manager worked with the father to coordinate and ensure that this third test was completed. The care manager really took the lead in setting up screening visits with the provider agency, making sure that meetings were being held, that all of the documentation was being gathered that the provider agency needed in order for this admission to be successful and smooth transition for the child. And with that said, the CM worked collaboratively with multiple stakeholders in all of this, and we did have a successful placement where the child was placed in an appropriate residential facility. So that's just one of our many, many success stories. So, as Danielle said, the CCO's care management continues to work diligently. I know that my team continue to work very, very closely with families throughout this time, and I know that they will continue to do so as we move forward. As the phases continue to reopen and we get back to our new normal. So I'm happy to be able to share that story with all of you.
Thanks, Kristen. So, as many of you probably know, being able to, getting a residential placement secured for someone is a difficult thing to do under any circumstance. So, that's really a great story. And actually, the story I have is somewhat similar. So I'll try to keep it relatively brief. But one of the things that we did at Care Design, realizing that care managers were going to be hearing a lot of really challenging situations, and sometimes it takes a village, right, to get to a positive solution. So we had put together an emergency response team, and so we were meeting actually in the beginning. We were meeting every afternoon, Monday through Friday, a group of us from the organization coming together to look at some of these challenging situations. And we had a situation come to us where there was a family that lived in the community, a mother, a father, and their young adult daughter. And the mother was diagnosed with COVID and was hospitalized and ultimately had to have her leg amputated. And so the daughter was home with her dad, who also had been previously diagnosed with cancer. And obviously both had been exposed, given that the mom had tested, had tested positive for COVID. So we were thinking, oh no, this is, really a very critical situation. And so the care manager, worked very, diligently, along with our internal committee, but also with, OPWDD, the local, the regional office, in terms of putting together a CRO packet. We worked with some other, family members who hadn't been as actively involved, but were able to, we were able to get them a little bit more involved in this situation while we were working to get it resolved. Ultimately, the daughter and the father did both test positive for COVID, but fortunately really didn't have very many symptoms related to that. And, through the advocacy efforts of the care manager, working collaboratively with the OPWDD regional office, we were able to find a residential placement, which was actually the same agency that had been her day service provider. So, they were familiar with her. There was a familiarity, on her part and her family's part with the agency. And when she moved in, actually staff from her day program, because the day program wasn't operating, worked at the residential program with her for the first few weeks to help her transition, more comfortably to her new home. So again, very, very similar story to what Kristen had outlined in terms of, having a real crisis situation come to our attention and being able to, resolve it successful. And, again, one of many examples, some have been, much less significant, but linking people with just, necessary and needed supplies. I know all the CCOs have had care managers out there running and doing drop-offs and getting supplies for people. And, it's really been, a very all hands on deck approach at all of the CCOs to trying to support people through COVID-19. So just want to close and thank everyone for your time. If anyone has, any questions or concerns, you can certainly reach out to folks at ADAPT and they could get in touch with Kristen or I. We're always happy to answer any additional questions. And I hope everyone enjoys the rest of your presentations and has a great rest of your day. So thank you very much.
Thank you so much. Have a good day, everybody.